So, welcome back to Pain to Performance. Thank you for those who listened in last week. This week we're going to be talking about knee pain and all things surrounding the knee. So, I guess between the three of us, what do we typically see when we're going through knee pain?
You want to kick us off, Chris?
Sure. I guess typically what we see with knee pain, from my experience working here, it has been things primarily around squatting and benching, because I guess a lot of people will run into a few situations where they may not have the right, quad strength, which can cause knee pain, but also the way that they are moving through their femur and their tib, I find quite important, when looking at knee pain. Would you guys agree?
So I guess with this style knee pain, you're more so talking like the front of the knee, like when the tendon gets pissed off and just starts screaming at you in like the middle of a squat, something like that.
Yeah, 100%.
Right.
That's more times than not what I've seen, but there has also been cases where I guess, I've had a few lifters where the tib and the femur aren't necessarily working too well together, and it's been the biceps fem long head tendon that at the back of the knee that's been quite irritated as a result.
Yeah, for sure.
It's been quite interesting to deal with there.
I guess that's often like the worst thing about knee pain is it just like fucking jumps around everywhere. You can have like the front, back, sides, like you can just come like on something, like you just wake up one morning and your knee's just like yelling and just like screaming.
It rotates from bottom of kneecap to top of kneecap, and you're like, what's going on?
The whole thing
inside the middle of the knee itself. What about you, Tom?
I guess like it's similar to like what we're talking about with shoulders. Like there's lots of different things like that can contribute to it. Like I suppose like one of the biggest things that we find with any sort of powerlifter or lifter is we get specific real quick. So we get very, very good at just like moving one particular way. So a lot of the time that's up, down, or at least we're trying to move up, down as much as possible. So like, I guess sometimes like it can be like a certain pain where, maybe we're training powerlifting a lot of the time, we get very, very, very good at going up, down, and then all of a sudden one day we try and go for like a 5K sprint when we may no longer have that certain range of motion that allows us to move forwards and backwards as comfortably. I mean, we all know when we see like a powerlifter move, we kind of look like we waddle or we run, or like we don't exactly have the smooth escape pattern anymore. So sometimes it's like very similar to the shoulder. It's just coming back to there's the task demands matching what our body can do in terms of our range of motion, our muscle mass, and like the ranges that we have strength to perform in. So yeah, it's very much like, I think it's very task dependent, very similar to the shoulders.
Yeah, I agree. I guess, Dave, in your experience, either anecdotally with yourself or with clients, how have you gone
Dave
with
is a knee pain enjoyer.
Okay, so I've had, I guess like I for those that don't know me, I started off with like really weird aches and pains like all over my body that would just randomly
Dave
pop
could
up.
not like squat to save his life.
Yeah, my body did not like me trying to do powerlifting, but we're good now. But I guess anecdotally for me, it's kind of swap knees here and there for whatever reason. The biggest thing that's probably helped me is just improving my hip flexion. So that's in turn made me better at squatting, better at deadlifting, and just having range of motions available to me so I can move freely and not just jam myself into certain positions. And that's what I see, I guess from like a clinician aspect as well, is people not having the range of motions required for what they're doing. So they might only have 45 degrees worth of hip flexion range, but they're trying to squat to depth in a powerlifting squat. So they run out of room, they dump, they just posteriorly tilt their pelvis hard into the bottom, run out of room, and then their knees go out. So it's like, that's probably the big one that I see, is the running out of hip flexion and then knees going out to you from there. So I'm just looking to restore ranges of motion that they don't actually currently have.
Yeah, cool. I guess, and leading on to the next question then, how do you go about doing that?
So I guess it depends on where they're missing it. So that generally comes from not being able to hold some sort of lumbar extension while they're doing their activities, so squatting, deadlifting, etc. So it depends if they're able to hold it in a squat, but they're losing the deadlift, or vice versa, or what ranges of motion they're actually missing, whether it's internal, external, whatever it may be. So for me, it's always just starting off with that, so making sure they can hold some kind of lumbar extension. That way they can actually flex the hip without just posteriorly tilting, flexing their lumbar really, really hard. Not that that's a bad thing, it just means they're running out of room. So that's usually my go-to, is making sure they can hold some kind of lumbar extension.
Yeah, that's good. That works really well at getting like hip flexion really quickly.
Yep. No, that's awesome. I guess, have either of you experienced knee pain when someone's deadlifting, like from a client's perspective potentially?
I guess I don't see it very often. Most of the time it's more like probably squatting or even benching. I guess like it's more common maybe sumo. Like if I see someone with sore knees with like a deadlift, it's probably going to be a sumo deadlift. I guess in my experience, that's often been like someone, like they're externally rotating the bar because they're really trying to open up their hips, get into a position where they can leverage themselves into the barbell. But sometimes they continue to externally rotate as they break the ground. And that could be potentially where maybe that's like aggravating their knees slightly, because they're continuing to scoop their hips under, like almost scoop their body into the barbell as they're breaking the ground, rather than letting themselves kind of create downward pressure and internally rotating their femur and just like engaging their quads to push and just like contract and stand up essentially. So yeah, I don't see it super often, but I guess like the couple of times I have seen it, usually it's a case of getting that person to still externally rotate to the bar if that's what they like to do, but then almost then internally rotating to break the ground, push through the feet, and then come up into the top of the deadlift.
Yeah, I think that's actually quite an important thing to note, because for the one person that I have experienced, or that I have had experience with that has had knee pain when deadlifting, it's because they're thinking and they've adopted this old school mentality of like, we need to supinate our feet, or we need to be on the outside of our foot the whole time.
Tripod foot,
100%. So, weight on the big toe, the pinky toe and the heel, and just really go on the outside of the foot. And that's how he would be walking. So he'd be getting this essentially like posterior lateral knee pain. And it took me a little bit of time to figure out as to why this was going on, until Tom mentioned, how's he walk? And then when we looked at how he walks, he's like, laterally putting pressure on his foot when he's walking. So he's, walking on the outside part of his foot. So it's sort of transferring to his deadlift. And then the way that we fixed it within 2 sessions was literally getting him to pronate or push through the middle of his foot and internally rotate. And as soon as he did that, his deadlift went up by 10, 15 kilos because he was able to actually generate force.
That's sick. That's good.
Which is sick. So major keys there: pronate to lift.
Flatten your foot.
Yes.
correct.
I guess another one that I've seen quite commonly, and this goes across the board, not only for lifters but also your gen pop and general gym goers as well. Knee pain when lunging.
Yeah, this one I've seen really commonly as well.
Talk us through this, Dave.
It's been interesting. Well, I actually want to hear what you have to say about this one, Chris, because I've seen it happen where some people get it on the front leg when they do lunges, but then they also get it on the back leg, which I find super interesting because there's a lot going on there, right? Like one leg's in flexion, the other's in extension, and the pain sort of jumps around. So I find that really interesting. Do you want to give us some insight there, Chris?
So I guess the first thing that I will sort of look at when looking at someone's lunges, starting off with the feet, because as I just explained before, feet is pretty important in terms of looking at if they are pronating their foot or flattening the foot when they are completing the movement. So if they typically are doing that but still getting knee pain, then we're going to look at, what's going on at the knee itself. Are they super abducted, or are they, too far into adduction when they are doing their lunge for the front leg this is, but then also what's their quad capacity like, because I find that with a lot of people that have poor quad capacity, if the muscles can't take the load, the patellar tendon is just going to cop everything, and if the patellar tendon cops everything, that's when they're going to be a bit achy in the knee. I guess from the back leg's perspective, it's going to be a case of them not actually loading the front leg, is what I found.
I like so they're just sitting back.
They're just sitting on that back leg and sort of being like, oh, my quad's burning in the back leg and I'm not feeling anything in my front leg. What am I doing wrong?
Almost like a reverse Nordic during
100%
sort of thing.
That's it. So it's like they're loading all the weight in that opposite leg as to the leg that's supposed to be working. So they get really uncomfortable and potentially like a big stretch to that rec fem on that opposite side. But then as soon as you try to get them to shift that load onto the front leg, to the working leg, it typically eases, if that makes sense.
Yeah, it makes plenty of sense.
Have you seen anything else different, I guess, with that, Tom?
I suppose the big one I always see is one-sided lunge feels great, feels mad, you can just pump out 1,000,000 reps at 4,000 kilos on that side. Then you jump to the other side and it feels like you can barely stand on it, sort of thing. I guess the whole thing with asymmetry in the body, making that very normal, we all have that one leg that feels more stable, more balanced. But I guess sometimes when you do feel it's unstable, we can try and find that we start twisting and turning more to try and create more tension to make us feel more stable. And a lot of the time if you have a knee pain, it can be that rotation or those torsional, or just relying on having to rotate constantly through a hip and twist stuff out, pulling the knees out constantly to create a heap of stability in that leg that maybe feels a little bit more wobbly as you're doing a lunge. That can sometimes be an irritating position. But yeah, I suppose like the way that I like to try and get around it is like just using like a stability stick. Like if someone just feels really wonky on one side of that lunge, you just get them to hold on to something so that they can just feel like they can shift themselves over that leg, feel like they can get on top of the leg rather than feeling like it's wobbly and it keeps trying to get away from them. And that can be really useful, just helping get rid of just like pains on like that side like that.
Yeah.
That's where I've been seeing on Instagram. I've seen a bit of a comeback with like Hatfields, except like split squat Hatfields, you know, lunges Hatfields, you know.
Just hang on and go hard.
Yep,
Big
create
fan
the
of that.
stability and just go hard.
Yeah.
So I've had them in my program for like the last 4 months now, 5 months, and I reckon they're goated. Like
Goat status.
hands down. Like, so I do essentially like a front foot elevated Hatfield SSB more or less. And yeah, it just helps me with the stability of having it like a Hatfield. It helps me really target, I guess, specific areas. So I can change the bias if I want it to be more of an adductor quad focus. I can change that bias where I'm, you know, leaning more in towards that IR and really flattening out my foot. Whereas if I wanted it to be more of a glute focus, I then shift that position so that way I'm a little bit more abducted and a little bit more in a hinge position through that movement as opposed to being quite vertical, if that makes sense.
Yeah, for sure.
So I think that by having that external factor of, you know, the stability from either the cage or, you know, a dowel or something like that, I think that it's, you know, really quite helpful to isolate the muscles in a sense.
It goes a long way. Yeah, just like taking out the middleman and just hanging on.
Yeah,
Makes it so much easier. Just to focus on what you need to do.
That's just the Kasem thing, right? It's just like you got more output, you know, make it more stable. So
that's it.
Yeah, that can be applied pretty well here.
I guess when we get someone coming into the clinic here to, you know, say, oh, I've got knee pain, fix me. What are the sort of things that we'd look for straight away, Dave? What would things be that you'd go to straight away?
Well, I would ask, like, I guess, like what movement it's starting with. So is it during a squat? Is it only at the bottom of the squat, only at the top of the squat, one leg, both legs? Whereabouts on the knee is it? Like, there's all the sort of questions you need to ask. When did it start? Did you wake up with it randomly, or was there an event that caused it? And then once you've got all this information, that'll sort of inform what sort of assessments you might run, or start painting a bit of a picture of what you think the problem might actually be if you've got enough information there. So once you sort of actually get to know the person and figure out what's been going on, then I just jump into an assessment and start looking at available ranges of motion, their body weight squat, their toe touch. And after that, you probably got a decent idea of what's going on. Even just asking them to show you videos, like if they're a powerlifter, they've probably got videos on their phone of them squatting or deadlifting, whatever that's causing them pain. So jumping into that would probably be like the first couple things that I would start with before getting into like a full assessment and seeing what's going on.
Yeah, cool. Tom, would you do anything different, or include, I guess, anything more specific once you've got more of an idea?
Oh, yeah, like the range of motion side, I think, is huge, because then I guess that also gives us a bit of information on like the center of mass side of things too. So like I guess like range of motion will generally indicate that we can move comfortably through a joint, but the other thing we have got to take into account of as well is like where our center of mass is sitting. Like, is it like moving like throughout the rep? Is it staying like in the same spot? Because I mean, ideally, especially when it comes to like the barbell lifts, we want to be trying to move as up down as possible and minimizing as forwards backwards as like little as we can, I guess. And especially if we want to lead into more of the pronation side of things, like the internal rotation side of things, to create a lot of force, as well, like coming out of a squat, for example. Like, we want to be making sure that our center of mass is staying right in the middle of our foot, and we're equally driving the knees forward as hard as we can as we hinge into the hips, so everything is just dropping straight down. So we need to make sure we have the range of motion to do that, like Dave was saying, and then make sure that person has the skill to be able to maintain, whether it's a technical side of things or whether it's like a load constraint kind of thing, just like making sure that they can stay balanced to where they need to be for that lift.
Yeah, cool. I think that's, I guess, a pretty well-rounded way between the two of you as to how we would look at, I guess, someone coming in with knee pain, right? I guess one of the trickier ones that I just want to touch on quickly is like meniscus injuries, because I know between research and what we do anecdotally, can sometimes be a little bit of a mismatch, although we do try to stay, I guess, as close to the evidence as possible, because a lot of people will come in and say, you know, I've got a meniscus injury, can't really load bear, or these things hurt, I don't want to do it to make it worse, and then they'll go opt for surgery like an arthroscopy and then end up being worse anyway, because there's not great outcomes following arthroscopes anyway. So I guess, what's your management strategy surrounding that?
I guess, like, so the meniscus is meant to like withstand compressive forces. So like it's a very strong part of structure, and like we can sometimes have those people have changes to their menisci and be completely asymptomatic, and then those changes are symptomatic as well. So I guess if we're talking about the ones that are confirmed symptomatic sort of cases, one of the best things we can do is we can try and make sure that at least we're sharing the compressive loads between like the medial and lateral sides. So this might be a little bit where we're starting to look at, you know, can someone's limb rotate when it needs to potentially avoid, you know, like valgus and varus stresses, which we can share between rotation stresses at the same time. So kind of what I mean, for example, is like if someone's constantly in a position where they're finding their knees very adducted, they're like in that valgus position that's typically thought of being very bad. It's not necessarily bad, but it's more so making sure that person can internally rotate their femur at the same time. So at least they're sharing some of the load between both the medial and the lateral menisci as they're moving into that more adducted or valgus style position. So it's very much just confirming that we can rotate the femur in and out depending on where the meniscus is being stressed or where it feels like it needs to be sharing the load. Yeah. And then just kind of then progressing and slowly introducing more exposure to load over time and make sure it all feels good.
Yeah, cool. I guess if we were to give a few examples as to, let's say, you know, a lateral meniscus issue, what would be 2 exercises that would be your go-to?
I guess like, so theoretically, if someone like is feeling like it feels uncomfortable when they compress their lateral meniscus, that's probably going to be coming from like more of a valgus style position where the knee's coming in. Because if your knee comes in, then it's going to be more like kind of compressing the outside menisci. Maybe that feels uncomfortable for someone. So I guess one of the things I'd like to do is make sure that that person, when they move into the adducted position, they can comfortably adduct, internally rotate those motions that generally move like together or couple together. So I'm going to make sure that person has an ability to, I suppose, like kind of perform hip extension, internal rotation, and adduction like comfortably, nicely together. They're not trying to like, I suppose, like excessively find they really need to valgus that knee to like encourage or cause that coupling to happen together, which is one of the reasons why we can see knees come together in a squat. So I guess the first and foremost kind of thing I'll start with before I pick the exercises is just working out whether this is more of like a lifting style thing or this might be day to day. Because if it's lifting style thing, I might be working more on like potentially like bilateral exercises that's going to be helping them with squatting, deadlifting. It might just be more so just getting them to actually slowly expose themselves to those positions where they feel more inner foot, more pronation, more adduction. Like, I suppose just expose more of those positions and let the coupling happening together.
Yep.
And then maybe if it's more sort of outside of the gym where it's like more maybe like running or walking, going upstairs, that's where we'll be probably looking more at your single leg exercises. So your Bulgarians where you have like the stick and you're letting yourself like kind of take the balance component out of it and you shift yourself into that more adducted, internally rotated position, that could be really good. And then other movements like hinging is often very nice at making sure we have space to get into internal rotation. So yeah, they're kind of like where I would start.
Cool. Dave, do you have any that you would go to, I guess, for either a medial or lateral meniscus if you've done any before?
Not particularly. I think the other thing that I've seen like more with the medial stuff is the big like crank knees out super hard, and sometimes sometimes all it's been is simple enough as just like stop pushing your knees out so hard.
Yeah.
And that'll just sort of take away some of that stress that's happening on the inside part of the knee. Again, like you've mentioned with the other filler that you had, was stop being on the outside part of your foot. 2 sessions later, things are feeling pretty good again. So I don't think I'd have any particular exercise I'd throw out there straight away. It would just be looking at how they move, their motor patterns, how they're performing exercises, and start with those big rocks first before throwing in any sort of big interventions.
Yeah. Yeah, cool. Okay. I mean, is there anything else, I guess, that you guys would say to take away and look for with your knee accessories, or not knee accessories per se? I guess more.
It's knee day today, gentlemen.
It's knee day. I guess more with your lowers accessories. If you are someone that is experiencing knee pain, what would be like a sort of like if there was to be like a 2 or 3 step, a flow chart type thing, tick boxes, what would they look like?
I suppose like the way I approach it is make sure we have hip flexion, and then make sure that we can push our knees forward as we're going into hip flexion simultaneously, and then just get big ass quads on top of that. Yeah,
good.
That's kind of like my 3.
That's sickening. I'd probably say the same thing. I'd say just be specific in your intent with your accessories. Like, don't just say, okay, cool, I'm going to train quads now, and then you just do belt squat leg extension.
Yeah.
And then call it a day and go home. Granted, those are fine exercises, but I think having a purpose behind them is really big. So finding out what ranges of motion you're missing, or maybe where you're weak and maybe where you need to get stronger in certain positions, and throw those in there so that they're actually helping and aiding your lifting, as well as obviously helping you get jacked as well. So whether that's with the help of a coach or, you know, a clinician like Tom or Chris here, just finding out what you need to work on and knowing what's going to help your lifting moving forward can have a big role with, you know, choosing the right accessory for you. I guess actually like answer the question of like what sort of checklist you would go through to find what accessories you need to put in. Again, that would be working with the coach, but I guess figuring out the things we've been talking about recently. Are you someone that needs to get better at getting on the inside part of your foot and you walk on the outside, or you used to be a big knees out enthusiast?
Yeah.
So choosing exercises that will encourage you to flatten out the foot, whether that's something wide stance where, you know, you're forced to be on the inside of your foot to create force. So there's a bunch of different things you can think about. And if you stop to think about it yourself, you probably come up with a couple. You just have to sort of put some time and effort into thinking about it. So.
Yep. Yeah, no, I agree completely. Awesome. I think that was. I think we covered the knee quite well, and I guess things that we can run into with the knee. If anyone does have any other questions or anything like that surrounding things we've covered today, feel free to reach out through Instagram with all of our handles, all being our first names _Performotion. So Chris _Performotion, Dave _Performotion, and or Tom _Performotion there. Feel free to reach out. But until next time, enjoy and get strong quads, guys.
Happy days. Cheers.